Thank you. Thank you, Acting Speaker. All protocol observed. There is a legal term, duty of care, which means a moral and legal obligation to ensure the safety and well-being of others. And the Democratic Alliance knows that this needs to be the blueprint for any public representative or government official, especially in healthcare. But on reading the annual report for 2021-22, one cannot see this. All you see is a celebration of mediocrity, excuses, sidesteps, and obfuscation of a humanitarian emergency. I take no pleasure in this speech, and I will take even less pleasure in the response to our speeches, as our speeches show the tip of the iceberg failure to provide access to basic health care over almost 30 years. And the responses will no doubt be filled with political language that takes little to no responsibility for the on-the-ground conditions. Let's be real. It's heartbreaking when the opposition's responsibility to find failures in a healthcare system is easy. The challenge was to narrow down the failures of gross negligence. There is a reported improvement in ambulance waiting times to an alleged and shocking 30 to 60 minutes. This is not an accomplishment, especially when the international standard is 80% within 15 minutes for life-threatening conditions. A reported amount of 1.6 billion was spent on the emergency services in this year, but on what? It's reported that it was for tracking of the fleet. However, when I went on unannounced oversight in various depots, the ambulances were used to transport staff, pick up cigarettes, and to do lunch runs. And no one could confirm the alleged 30 to 60 minutes waiting time. In fact, everybody reported it to be between 3 to 4 hours. The promised state-of-the-art Kopanong hospital that cost the taxpayer 38 million rand in 2020 is still not completed. There is no roof, the walls are cracked, and the foundations are weakened as a result of exposure to the elements. And this is not an isolated example of a political promise that was not implemented and now, quite conveniently, forgotten about. Something needs to change. We receive multiple calls from patients who are waiting in emergency rooms with threatening diseases and injuries. Again, let's be real. We all know that the waiting times could range anything between 6 hours, if you are lucky, and 30 hours, regardless of what is written in reports. And the international standard is a minimum of an hour. What is the budget spent on? Medico-legal costs and claims in the billions. This is an immediate indicator that the system is failing or has failed. I'm further concerned that real claims are being ruled as frivolous as the outside consultants are paid on commission. I have not touched on the lack of patient records, nor the increase of suicide rates to over 90% more than the previous year. I have not touched on the lack of future planning or blaming of COVID or foreign nationals or poverty. Just a side note, all of these the responsibility of the governing party to mitigate. It is just too easy to find the failures. But as a human, I really wish that our success stories were every day, but they are not. And I really wish that the failures became needles in a haystack, but they're not. It is our duty of care to stand up and make a difference within this department. I thank you.